So now I am going to tell you about definition of granuloma. So what is definition of granuloma? Now we will see, right? So how we are going to define granuloma? As already we have learned, there is a elongated slipper shape epithelioid cell. So these are epithelioid cells, right? These are epithelioid cells. Epithelioid cells will be surrounded by collar of lymphocytes, surrounded by collar of lymphocytic cells, right? So epithelioid cells will be in the center and they will be surrounded by collar of lymphocytes. Epithelioid cells, they have fragile cytoplasm, and that is why during inflammation they will fuse together and they will form multinucleated giant cell. So what I said, epithelioid cell will fuse together and they will form multinucleated giant cell. So what are these multinucleated giant cells? When you will look at the arrangement of the nucleus, see this arrangement of nuclei in this multinucleated giant cell is like a horseshoe pattern. So see this is the horseshoe pattern. So what we are seeing is the horseshoe pattern of the nuclear arrangement, which is also called as peripheral. So remember, this is peripheral or horseshoe pattern of arrangement of the nuclei. So nuclei arrangement is peripheral or horseshoe pattern. So examiner asked this question, what is name of this giant cell? What is name of this giant cell? So this is called as Langerhans giant cell. Langerhans. See what I have written, Langerhans, not Langer. Langerhans cells are antigen presenting cells of skin, right? So they are not Langerhans, they are Langerhans giant cell. So these are Langerhans giant cells, right? So that difference we must keep in mind. It is Langerhans giant cell, not Langer. Langerhans, not Langer. Langer is the antigen presenting. Langerhans cells are antigen presenting cells of the skin, which is one important question in exams, right? So we have seen peripheral arrangement or horseshoe shape arrangement of nuclei is seen. So whenever we see peripheral or horseshoe shape arrangement of nuclei, they are called as Langerhans giant cell. This is one type of multinucleated giant cell. Second type of multinucleated giant cell which we are seeing, number of nuclei will be more, and that is why they will be having haphazard arrangement of the nuclei. So what we are seeing here, there is a haphazard arrangement of the nuclei. So because of this haphazard arrangement of the nuclei, they are different from the Langerhans giant cell, and that is why their name is foreign body giant cell. So they are called as foreign body type of giant cell. Foreign body type of giant cell. So these are two types of giant cell, Langerhans giant cell and foreign body type of giant cell. These are multinucleated cells. They are derived from epithelioid cells. Because of the epithelioid cells will fuse together and then they will form multinucleated giant cells, right? So this is the ideal definition of the granuloma. So granuloma is epithelioid cells in the center surrounded by collar of lymphocytes accompanied by giant cell. Epithelioid cells in the center surrounded by collar of lymphocyte accompanied by giant cell. This is the complete definition of the granuloma. So once you know this, then you can understand what is the granuloma or how you will be able to identify. The same way in exam also you will see the flat elongated cells which will be epithelioid cells surrounded by lymphocytes, mononuclear cells will be there, and multinucleated giant cells will be clue to identify that this is the granulomatous inflammation, right? So this is how we can understand granuloma definition, and we will apply this knowledge to identify images in our exams, right? Now coming to the types of granuloma. Now coming to the what are the types of granuloma? So what are the types of granuloma? So when we discuss about types of granuloma, we should understand we can divide them into three broader categories: caseous granuloma, or you can say caseating granulomas. So caseating granulomas, this will be number one type. Then second group will be non-caseating granuloma, non-caseating granuloma, and third is a special categories of the granuloma, right? So I am keeping special categories, right? So now we are going to read these types of granuloma into three basic categories: caseating, non-caseating, special type of granulomas. What are the caseating granulomas? So here we will keep the name of tuberculosis. TB is caseating granuloma, right? Apart from TB, even histoplasmosis is also example of caseating granuloma. Histoplasmosis, and one more fungal infection, that is coccidioidomycosis, right? So this is also an example of caseating granuloma. So these are caseating granuloma. Out of these three, what we need to understand, this TB is important MCQ in exam. Okay, what is TB? TB is caseating granulomas as well as this is non-caseating granulomas also, right? So here we must remember that non-caseating also, we can see non-caseating granulomas in TB also. So that was the older question in All India exam. So non-caseating granuloma we can see in TB, we can see them in sarcoidosis, we can see this in Hodgkin's lymphoma, older All India question, Hodgkin's lymphoma, and it will be also seen in leprosy. So leprosy is also having non-caseating granuloma. So this point also we have to keep in mind. Leprosy also has non-caseating granuloma. So non-caseating granuloma in leprosy, when we are seeing in leprosy, this non-caseating granuloma will be seen in which type of leprosy? This was the All India 2015 MCQ, right? Borderline, lepromatous, tuberculoid, like that option was given, right? So we are talking about granuloma. Granuloma seen in TB. So TB like leprosy will be tuberculoid. So this will be seen in tuberculoid leprosy. So that was the answer. So tuberculoid type of leprosy will be having non-caseating granulomas, right? So tuberculoid leprosy will be having non-caseating granuloma. This is how we have to solve this question. So we can easily make it out. This is the question in exam. They had asked, okay, non-caseating granulomas will be seen in TB, sarcoidosis, Hodgkin's lymphoma, and fourth option in exam, which was not the correct option, was the metastasis of the cancer. So now we can see these are the important things which examiner had asked, and this is how question will be framed in exam. A special type of granuloma, the third one which I am going to discuss, is very important, and the question had been asked in previous year All India and this year All India exam, right? So now we are going to discuss a special type of granuloma. So in a special type of granuloma, number one which I want to tell you is the naked granuloma. This question was asked in All India exam 2016. कि naked granulomas are seen in which condition? So naked granulomas are seen in sarcoidosis. Naked granulomas are seen in sarcoidosis. So this was the question in All India exam 2016, right? So now we can focus on what could be the future question. This is the old question, right? So what I have shown you here, naked granuloma is seen in sarcoidosis. This is the old question. So now we are planning for the future question. What will be the future question from this topic? Future question will be naked granuloma, what is absent? Because if you remember, I said the definition of granuloma is epithelioid cells in the center surrounded by collar of lymphocytes accompanied by multinucleated giant cell. So out of these component, which will be absent in naked granuloma? So naked granuloma, there will be no lymphocytic infiltrate. No lymphocytic infiltrate. So that collar of lymphocytic infiltrate will be absent. So either no lymphocytic infiltrates, or you can say scanty lymphocytic infiltrate will be there, right? So that is the another future important MCQ which examiner can repeat in exam, right? So naked granuloma which is seen in sarcoidosis, that collar of lymphocytic infiltrate will not be seen, right? So that point we have to keep in mind. Either that collar will be not seen, or you will be seeing only one or two lymphocyte in those areas, right? That's all. So this is the naked granuloma. Second thing which I wanted to tell you in a special type of granuloma, which was the previous year All India question also. That granuloma is called as stellate granuloma. Stellate granuloma. right? Stellate granuloma. Stellate granuloma, why this name is given and what is the speciality of this granuloma? Usually, if you remember, I started कि granuloma is a pattern of chronic inflammation, right? So chronic inflammation should have macrophage or lymphocyte. What about neutrophil? You remember in the beginning of chapter what I said, acute inflammation, neutrophil is the dominant cell, chronic inflammation, macrophages are the dominant cell. But now in this stellate granuloma, though it is a chronic inflammation, but they will be having involvement of the neutrophils. So this is also example of neutrophilic granuloma. This is example of neutrophilic granuloma. What happens in this neutrophilic granuloma? When you will see the histological examination, or microscopic examination, because of the neutrophil, they will be having star shape. Necrosis, right? So these are the star shape necrosis in the granuloma because of the neutrophilic enzymes, right? So neutrophilic enzymes are causing star shape necrosis, and because of star shape necrosis, they had been given a name of stellate granuloma. So that is why stellate granuloma name has been given to this type of granuloma. So question was, in All India exam, question was stellate granuloma or stellate abscess is seen in which condition? Stellate abscess is seen in which condition? So it will be seen in cat scratch disease, and that was the right answer in exam. So stellate granuloma is seen in cat scratch disease, and this was the question in All India exam 2018, right? Stellate abscess or stellate granuloma. Because of this abscess, they are also called as stellate abscess. So it is seen in cat scratch disease, right? So this is the second type of special granuloma. Third type of granuloma, third type of special granuloma is called as Dirk's granuloma. This is called as Dirk's granuloma. Dirk's granuloma was again All India and AIIMS both question where you will find Dirk's granuloma. Dirk's granuloma will be seen in cerebral malaria. So answer is it is seen in cerebral malaria. So Dirk's granuloma is seen in cerebral malaria, which is caused by which infection? Plasmodium falciparum, right? So this is caused by Plasmodium falciparum, right? So Dirk's granuloma is seen in Plasmodium falciparum cerebral malaria. So it is seen in cerebral malaria. And what will be the appearance of the Dirk's granuloma? You will see a brain blood vessel. And in this blood vessel, you will find or you will notice they are flooded with rings of Plasmodium falciparum. This is the ring, and this blue color is the chromatin of the falciparum rings, right? So this is how you will be noticing rings of Plasmodium falciparum. So these are rings of Plasmodium falciparum. So this is the third type of special granuloma. So we have seen naked granuloma, we have seen stellate granuloma, we have seen Dirk's granuloma, which is seen in malaria, cerebral malaria, caused by Plasmodium falciparum, and this was the question also in AIIMS as well as All India exam, right? So it is seen in cerebral malaria. So these granulomas, we have discussed their mechanism, their definition, and then we have discussed about how we will classify this special type of granulomas along with caseating and non-caseating, right? And now we are going to see how we are going to identify those images in our exams, right? So whenever we are seeing any image about granuloma or any pathology question, if you remember, as I said, there are three important rules: rule of 5, rule of observation, and rule of comparison. So the same thing we are going to do in this case also. So as I was telling you, to understand the image of granuloma, we should follow those three rules, right? Rule of 5, rule of observation, rule of comparison. So when image is given in front of us, that time we have to look for the 5 areas, as I said, 1, 2, 3, 4 corners and the center. So when you are looking at the center, what you are noticing? When you are looking at the center, you are noticing in this area, what I am marking here, in this area, there is a amorphous granular pink areas, amorphous granular pink area. So amorphous granular pink area will be suggestive of caseous necrosis, right? That's what we have learned. So this is the area where we are looking at caseous necrosis, amorphous granular pink area without any nuclei we are seeing. So this is the area where we are looking at caseous necrosis in the center. 1, 2, 3, 4. So rest of the 4 areas when you will focus. So just see this cell which I am showing you. If you look at this cell, you can notice there is a cell and they are having peripheral arrangement of nuclei. So what is this? What is this? It's a Langerhans-Janz cell, right? So what we are seeing here, it's a Langerhans-Janz cell. Langerhans-Janz cell, right? So this is Langerhans-Janz cell. So when we are looking at this cell, this is also same like Langerhans-Janz cell. So this is also similar cell. So this is Langerhans-Janz cell. Again, you are seeing one more Langerhans-Janz cell. So when we are seeing caseous necrosis, Langerhans-Janz cell, and you can notice so many small mononuclear cells are visible. So you can see a small dot blue. These are the nuclei of lymphocytes, right? So these are the nuclei of the lymphocytes. So these are all lymphocytic infiltrate, right? So lymphocytic infiltrate, and at places you can observe epithelioid cells also, because it's a scanner view. So it requires more meticulous vision to see this epithelioid cells, right? So we are seeing epithelioid cells, right? So these are epithelioid cells. These are the lymphocytic infiltrates. What I'm showing you here, it's a group of lymphocytic infiltrates, right? So lymphocytic infiltrates. So this is the perfect picture of the granuloma. So in granuloma, a scanner view, I am seeing a caseous necrosis, lymphocytic infiltrate, epithelioid cells, and Langerhans-Janz cell. So this is how we will identify. This is a scanner view, right? So when you will go to the high power view, then you will observe. So this is the high power view, and this is the beautiful picture of the granuloma, which is including nearly everything of the definition of the granuloma. So see 1, 2, 3, 4, 5, and when you are looking at this area, what are these cells? Can you notice? These cells are elongated cells. Can you see? These are elongated cells. So all these are elongated cells. So these elongated cells are called as epithelioid cells. So these are epithelioid cells, right? So we are looking at epithelioid cells, right? And when you are looking at this area, you can see so many dark nuclei containing mononuclear cells. So this is the collar of lymphocytes. So these are collar of lymphocytic infiltrate. So you can see epithelioid cell, collar of lymphocytic infiltrate. All these are lymphocytes which are showing dark blue nuclei of the lymphocytes, right? And then you observe there is a cell which is multinucleated Janz cell. Look at this multinucleated Janz cell. You can see the nuclei arrangement is peripheral or horseshoe shape. So what is this? This is Langerhans-Janz cell. This is Langerhans-Janz cell. So that is what I was telling you. This is the beautiful picture showing the definition of the granuloma. Epithelioid cells in the center, surrounded by collar of lymphocytes, accompanied by Janz cell. When you will look at other areas, you may observe that there is another group of Janz cell. Can you notice this cell in the center? So never forget rule of 5. 1, 2, 3, 4, 5. In the center, the mid area, you can notice the nuclei arrangement in this multinucleated Janz cell is haphazard. So what is this? This is the foreign body type of Janz cell. So this is the foreign body type of Janz cell. So foreign body type of Janz cell, and again I will show you this is what. Can see these are elongated epithelioid cell. See again elongated epithelioid cell, again elongated epithelioid cells. So numerous epithelioid cells are seen. So epithelioid cells, then foreign body Janz cell, and if you look at all these cells, these are the lymphocytes. These are the mononuclear lymphocytic infiltrates. So these are the lymphocytes. So again in this picture you can see epithelioid cells, then lymphocytes, and then foreign body Janz cell. So this is again a granuloma, right? So this is the definition and picture of the granuloma. Now look at this granuloma. What is the characteristic in this granuloma? When you will look at the 5 areas, then observe and compare with the earlier finding, then you can see that these are granulomas. See, what I'm marking, these are all the granulomas. These are all the granulomas when you are watching rule of 5, right? Then you observe in all these granuloma, you can see giant cell. See, there is a giant cell, there is a giant cell, right? But what you are observing, lymphocytic infiltrate, that color of lymphocytic infiltrate is scanty in any of them. No lymphocytic infiltrate in any of them, or you can say scanty lymphocytic infiltrate. So you can see scanty lymphocytic infiltrate. So this type of granuloma is called as naked granuloma. So this is the naked granuloma which we often see in sarcoidosis. You remember naked granuloma in sarcoidosis. So this is the picture of naked granuloma where we are seeing epithelioid cells, where we are seeing very scanty 1 or 2 lymphocytic infiltrate. It is not earlier, as I have shown you, color of lymphocytic infiltrate is not there. So when lymphocyte color or lymphocytic infiltrate is absent or scanty, that is called as naked granuloma. An example is the sarcoidosis, right? This is the beautiful picture where you can observe there is a necrotic area. You can see this area is a very pink amorphous granular. This is the necrotic area, and this necrotic area, if you observe, they are having one characteristic shape like a star. So you can see this is a star shape necrosis. So this is the stellate abscess or stellate granuloma, right? So this is the stellate granuloma, and already we have read stellate granuloma will be seen in cat scratch disease, right? Third one, you can see this is the brain autopsy specimen of a child, and this is a special stain which is called as Field's stain. This is the special stain which is known as Field's stain, right? And in this Field's stain, what we are observing, this is the brain blood vessel, right? So what I am showing you here, this is the blood vessel of the brain, right? So cerebral blood vessel. In this cerebral blood vessel, we can notice this green color areas, and their dark color is the chromatin. So this is the green color is the ring. So these are rings of Plasmodium falciparum. So these are rings of Plasmodium falciparum, right? So this is the picture of Dirk's granuloma, which was Ames question in 2015. Dirk's granuloma is seen in cerebral malaria. So we are seeing a cerebral malaria, brain blood vessels, and they are having rings of the Plasmodium falciparum, right? So this is how we will identify a special type of granulomas. In the discussion of granuloma, we have seen, right, we have seen various types of granulomas, caseous, non-caseous, and then special type of granuloma, and we have discussed two giant cell, right, two multinucleated giant cell. One was Langhans, second was foreign body giant cell. Here I would like to emphasize few more things about giant cell when we are discussing about giant cells. So this is important point to understand when we are discussing about giant cells. So in our human body, we will be having two types of giant cells. One will be the physiological and one will be pathological. So now we are dividing giant cell into two broader category: physiologic giant cells, which is normally present in our human body. So physiologic is the normal type of giant cells which we normally find in our human body, and second is the pathologic, right, which is seen in pathology only. So pathologic and physiologic. So these are two type of giant cells. Physiologic giant cells examples, examiner may ask in your exam, in bone marrow, presence of megakaryocytes. So megakaryocytes are giant cell which are seen in bone marrow, and another bone marrow physiologic giant cell will be osteoclasts. So osteoclasts are also considered as an example of giant cell. So megakaryocyte and osteoclasts are giant cell. Pathologic giant cells, there are numerous examples, right? For example, when you take the example of the Ashkoff giant cell, Ashkoff giant cells. So Ashkoff giant cells are seen in rheumatic heart disease. So this is seen in rheumatic heart disease. So actually Ashkoff giant cell will be diagnostic of rheumatic heart disease, right? So this point we have to keep in mind. Ashkoff giant cells are diagnostic of rheumatic heart disease. This is one pathological giant cell. Another pathological giant cell is the Reed-Sternberg cells. Reed-Sternberg cells. Reed-Sternberg cells are seen in Hodgkin's lymphoma, right? So they are seen in Hodgkin's lymphoma. So this is the second type of giant cell. Third type of pathologic giant cell which I wanted to discuss here is Taunton giant cell. This is the question in older All India exam. Taunton's giant cells are seen in which condition? So that was the question. So remember, Taunton giant cells are seen in xanthomas. So these are seen in xanthoma. So that was the right answer. Taunton giant cells are seen in xanthoma. This was the question in All India exam. Right. So what will be the future question? Image based question, because Taunton giant cell images are very easy to identify in your exam. Why I said very easy to identify in your exam? When you will see them like this, this is the giant cell, you will find that arrangement of nuclei is like a ring of nuclei. So now you can see, we will be seeing ring of nuclei. So what I am showing you here, ring of nuclei. So they will be having ring of nuclei, and within the ring of nuclei you will find cytoplasm is normal or intact. Cytoplasm is normal. So within the ring of nuclei we are seeing normal cytoplasm, and outside you will be seeing foamy or clear cytoplasm. Foamy or clear cytoplasm. So that is how you have to identify whenever you see a ring of nuclei, and within the ring of nuclei normal cytoplasm, and outside you are seeing foamy cytoplasm. So this will be the property of Taunton's giant cell, which is seen in xanthoma, right? Fourth one is previous year All India question, that is called Warthin-Finkeldy giant cell. Warthin-Finkeldy giant cell. Question was, Warthin-Finkeldy giant cells are seen in which infection? And answer was measles, right? So Warthin-Finkeldy cells are seen in measles infection, and when they will be affecting the lung tissue, this will be causing measles will be causing atypical pneumonia. So what is name of this atypical pneumonia in measles? So atypical pneumonia in measles, atypical pneumonia. So remember, this will be causing atypical pneumonia, and atypical pneumonia which is seen in measles are called as Hetz pneumonia, right? So this point also we have to keep in mind. This is called Hetz pneumonia. Examiner may ask this question in future exam also, right? So atypical pneumonia which we are seeing in measles infection, they are called as Hetz pneumonia. So Warthin-Finkeldy giant cells are seen in which pneumonia? Answer should be Hetz pneumonia, which is caused by measles, right? So that was the question in All India exam previous year. So how to identify Warthin-Finkeldy giant cells? Warthin-Finkeldy giant cells will be irregular. Now you can see how are they? They are irregular giant cell, multinucleated giant cells. In this irregular giant cells, what you will notice apart from this, you will notice they are having eosinophilic, intranuclear as well as intracytoplasmic viral inclusion. See what I am saying? Eosinophilic viral inclusions. Eosinophilic viral inclusions will be seen. So eosinophilic viral inclusions will be seen in this giant cell. Now question is where? Inside the nucleus or inside the cytoplasm? So your answer will be this eosinophilic viral inclusion will be present in both cytoplasm and nuclei. So cytoplasm and nucleus both will be having this eosinophilic dot-like punctate viral inclusion. So this will be present inside the nucleus also, and this will be present inside the cytoplasm. So this is the perfect picture of Warthin-Finkeldy giant cell. Irregular giant cells, eosinophilic viral inclusion in nuclei, in cytoplasm, both places, right? Now we will see these giant cell. See, this is how a question will be asked in our exam, right? So this is the very characteristic picture. While seeing itself, you can make it out. Okay, this is the Taunton giant cell. How we will know that? Now you can see there is a ring of nuclei. You can see this is the ring of nuclei, right? And you can see within the ring of nuclei cytoplasm is normal, and when you are looking at the outside area, when you are looking at outside the area of the cytoplasm, you can see there is a foamy cytoplasm, right? So ring of nuclei, you can see there is a ring of nuclei. Nuclei is having normal cytoplasm, and outside there is a foamy cytoplasm. So this is a Tauton-Jahn cell. So what is this picture? This picture is Tauton's Jahn cell, and Tauton-Jahn cells are seen in which condition? Xanthoma. So that is how question had been asked in All India exam, right? So this is how we can identify. Look at the another picture of the Tauton-Jahn cell. See, a beautiful picture which examiner may ask in future exam. If you look at this Jahn cell, can you see this? There is a ring of nuclei, cytoplasm is normal, and outside you can see foamy or clear cytoplasm. Same description holds here also. You can see there is also one Tauton-Jahn cell. See, look at this cell. This is also Tauton-Jahn cell. Look at this cell. Ring of nuclei, cytoplasm is normal, and outside it is foamy or clear cytoplasm. So there are numerous Tauton-Jahn cells are seen in this biopsy of the xanthoma patient, right? Now look at this picture, which was the question in All India exam, right? Now we are looking at the picture of the lung biopsy. In this lung biopsy, you can see this is the alveolar septa, and now you can notice there is a cell irregular appearance, and you can notice there is a nuclei. These are nuclei, and in this we will notice that eosinophilic punctate viral inclusions are present, and same color of the viral inclusion. Remember, the same color of viral inclusion is seen here also, right? So we can see that both intranuclear and cytoplasmic inclusion in an irregular. You can see there is another beautiful irregular Warthin-Finkeldy Jahn cells. You can see this area is full of small point or pinpoint like viral inclusions, right? You can see pinpoint like viral inclusions, and similar viral inclusions are seen inside the nucleus also. So that is why I am saying it is both nuclear and cytoplasmic, and this is the Warthin-Finkeldy Jahn cell, right? So this is how we will identify Warthin-Finkeldy Jahn cells, which is seen in measles, and this pneumonia is called as atypical pneumonia known as Het's pneumonia, right? So this is how we will understand about granulomas. So this is granuloma, which is a pattern of chronic inflammation, right? So as I told you, what will be the fate of chronic inflammation? What will be the fate of chronic inflammation? Now we will see.